Hi, how are you doing? Hope you're doing well. So for today's videos, I will talk about the process of applying and becoming a patient sitter. So for the whole video, I will walk you through the process of applying for the job as a hospital patient sitter. So let's jump into it. So a quick summary. As a patient sitter, especially in a hospital, your main job is to observe and monitor the patient condition and behavior. Most of the time, you will work under supervision of a nurse. So if the patient condition, like vital sign or any behavioral changes, you have to tell the nurse immediately so the nurse could come in and then fix the situation. Most of the time, that is your job. Sometimes you help the patient with the basic need, like walking around, eating, dressing. But most of the time, you have to observe the patient. So for the requirement for this job is all you need for this job is a high school diploma and a BLS for healthcare provider. This BLS CPR card, you can get it through AHA, American Heart Association. Now, those are only requirements for this job. For the pay scale, for this job, you get paid around, on average, around $11 an hour. So that means you probably get paid around $18,000 to $28,000 a year. So $18,000 to $28,000 a year based on your experience and where you work at. So this could fluctuate, depend on where you work and based on your experience. Alright, as you can see, right now we are on the website Indeed. This is a website I use to look for job. So on the Indeed website, the first thing you do is you put in your job list that you want. So I put in patient sitter for what, and the location is where. I put in Los Angeles, California, and this advanced search where you can put it down. Like for example, right now I put in within 25 miles. So it show up different type of job listing for patient sitter. So for example, right now I click on sitter per diem union. So according to this job listing, the responsibility for this job is you work under the supervision of a nurse. The patient sitter maintain constant visual observation. Your main job is to observe the patient activity and behavior on a regular basis, and you tell the nurse any changes to the patient condition. That's your main responsibility according to the job listing. Now for the qualification, as you can see, qualification-wise, for education, all you need is high school diploma or equivalent. You need a knowledge of the basic computer skill and Microsoft Office, so for like basic input for data. Ability to communicate in English, orally, and in writing. I mean, that's pretty given. BOS, HA, that means CPR for BOS, healthcare provider, from American Heart Association. Now you need this before when you get hired. So when you apply for this, you get asked for interview, and they will ask you for your high school diploma and your BOS card. So make sure you have those two when you go into your interview. And that's pretty much it. So let's say you click on the apply on the company site, right? It will take you to the company's website. As you can see right here, this is at their company website, Prime Healthcare. The information is still the same. You have the job responsibility, the qualification. The difference is that you can see the info. So let's say for the key tag, you get USA, California. The city is in Linwood. Your job ID category is A. The position type is per diem. Okay, so let's walk through the type of job you get. So this is a hospital job, right? So you can get either full-time, part-time, or per diem. Per diem, let me explain what per diem is. Actually, let's go to full-time first. Full-time is you working 40 hours a week. 40 hours a week is considered full-time. Part-time is between 20 to 30 hours a week. Per diem, that means you're probably going to be working around, I would say, 2 to 3 days. So it could be 16 to 24 hours a week. It depends on your the place you work at. But you get a month of schedule, and your schedule will change each month. And your shift will be daytime. So usually for hospital, it will be daytime, evening, and nighttime. Yeah, so day, evening, night. Night could be considered graveyard, so it depends on the hospital what they're gonna put. But that's pretty much it. Now for application wise, you just click on apply for this job online, and they will ask you for your basic information, like what's your name, your email, your phone number, and then you send them your resume, and that's it. Well, I hope you learned something new from this video. What is your thought on the hospital patient sitter job? Please comment down below and share your thought. And like and subscribe. On this channel, I talk about my life experiences and my journey in healthcare. Well, I hope you have a good day. Take care of yourself, believe in yourself, trust yourself, and love yourself. And I will see you again on the next video. Bye. Take care.